is. Should I have done a root canal, or what else could I do now?
If the tooth is broken off at the gum line, as it sounds like it is, there's not going to be a very good long-term solution to restore that tooth. Also, being a wisdom tooth, it's very difficult to keep wisdom teeth clean. Our jawbone pretty much prevents the toothbrush from getting all the way back there. And that's why most dentists recommend having them removed. Without looking, of course, the way it sounds, I would probably be recommending removing the wisdom tooth to make sure that it doesn't have an infection that's jumping over to the tooth supporting that bridge, and then you end up losing the bridge.
Right.
That leads, before we finish up, I do want to say one thing. When it comes to silver filling removals and amalgam removals, there are some dentists out there that talk about something called cavitations. And what cavitations basically is saying when you had a tooth pulled, your wisdom tooth pulled, years ago, there was tissue that was left in the jawbone, and that tissue is causing all sorts of infections and health issues, and that they need to do cavitations. Cavitations is basically where they're going to go back in there, without being gross here, cut the gums, cut the bone to get to this so-called pocket of tissue, clean it out, and then let it heal again. From my standpoint, there is no way that can be true. There's no possibility of it happening. First, the way wounds heal, when you pull a tooth and there's a hole in the jawbone, the tissue doesn't jump that gap and then everything heals underneath it. The tissue goes down the socket where the tooth was and then grows up. Just like any cut on your arm, you get a scab and the tissue grows under that scab and then pushes the scab up. And that's how wounds naturally heal. It's the same in the mouth. And so these dentists that are trying to say cavitations are necessary, they're just going back into a jawbone, in my opinion, opening another hole up, causing trauma, and closing the hole up. That's doing the same thing as when the tooth was pulled. So how could that be a treatment modality? And I had a patient here this past week that I talked to a dentist in California that said he had to fly out there, was going to be in a hospital for a week and do these cavitations and blah, blah, blah. There's dentists out there that are trying to take full advantage of this mercury scare and are doing things that are more damaging than good. So from my standpoint, cavitations is not a real procedure and something I would not do.
Okay. I have one last question I'd like to ask. I know there are several products on the market for brushing your teeth and oral care. Do you have a recommendation as far as electric toothbrushes, water picks, all of those kinds of things?
Sure. Rotary toothbrushes are now becoming standard and are shown to work better than a manual toothbrush. Oral-B has a good rotary toothbrush, and then Sonicare has the ultrasonic technology with it. The key to these toothbrushes is to use them properly. If you use a rotary toothbrush but go back and forth real fast, the rotation action never has a chance to really contact the tooth. Same with the Sonicare. You have to go really slow and let the brush do the work for you. So you're going to go around each individual tooth so that those toothbrushes get to do what they need to do. From a mouthwash standpoint, Listerine has always been somewhat the standard, but it's always had a lot of alcohol in it. And Crest came out with a Pro Health mouth rinse, and Discus Dental is a company that has come out with a mouthwash that you could only get in the dental office before, and they are now marketing it in mainly drugstores. That's a great product, and of course right now I'm drawing a blank on the name of it. There's also, from a water pick standpoint, a water pick is nice. Along with a toothbrush, it's shown scientifically to help keep teeth cleaner. There is a water pick called a HydroFloss, HydroFloss. It actually demagnetizes the water. It does something to the water that makes it more difficult for plaque to adhere to a tooth. So it's better than any other water pick, but a water pick is better than no water pick at all.
Okay, thank you.
Sure.
Great. Well, Doc, I think you have earned more than earned your next presentation here.
Well, good.
Thank you so much. This has been great. It's lots of great information that has been shared on this webinar, and we are really looking forward to many more, hopefully, that you would help to do for us. And people are saying thank you so much as well. So we appreciate you, and we might still, some people are still, obviously, I know this is going to come. So if you're not open to it, I will understand. But people are going to still email us with more questions, and I know you're very, very busy. If you can take care of some of them, that will be fine. If not, we understand completely as well.
Yeah, I mean, I understand, whatever you want to do is fine with me. If we don't get to everything tonight, some of them email me, on that information at diamondsmiles.com. That's fine also. It might take me a couple of days, of course, to respond to all of them.
Mm-hmm.
But, I check those every day. And so I have one of my goals is just to open everybody's eyes and see what we can do. And so I'm always willing to answer questions that people have.
We appreciate that, and lots of people typing in thank yous to express their appreciation as well.
Well, I just appreciate the opportunity to speak and talk again about something that I feel very passionate about.
Absolutely. Well, Sherry, anything else?
I don't think so, except during the webinar, and I was paying attention because I can multitask. I did get Dr. Koenig's things all in the store, so if you were interested in that, everything's on our website.
Okay, and next week, Tuesday, we'll be having the talk on healthy coffee. You need to be on it.
Yeah.
If you drink coffee.
I wish we could give everybody a sample and they could all drink some while we had the webinar.
I know. It's really good stuff. Great taste, too. It's
It is.
a little different from your regular coffee, but I tell you, it makes all the difference, health benefits-wise. I mean,
The whole world could have Gano breath.
Gano breath. Sherry.
Oh.
All right. Okay. Well, good night, everyone. Dr. Lula, again, thank you. Good night, and we'll see you all next week.
Good night.